think the three main issues on health supply chains that we need to be looking at are really around the HR issues. The first one is that of advocacy, of ensuring that governments, particularly in low and income countries, understand the importance of health supply chains, particularly to deliver medicines and health commodities to improve the results of their healthcare programs. So it's that advocacy. Governments are very stressed, and it's important for us to be able to advocate to them to understand the need to invest their time and their energy in that particular area. So that would be the first point. The second one, which flows from that, is ensuring that the leaders of health supply chains in low and low-income environments have both the technical competencies to complete their job, but also the management competencies to do their job. And so in this, we're focusing on leadership. And so it's not only the skills and competencies, but are the positions of health supply chain managers at the appropriate level in the supply chain and in the government structure. Often the conversations happen at a ministerial level, and health supply chain leaders are not at the table. They're not even thought of. It's often the doctors and the senior nurses that have the minister's ear. So it's important that we look at how to, one, develop the skills and competencies of health supply chain managers, but also look at their enabling environment to see where they need to be pitched in terms of their position and their supportive environment to be able to make that change that's so badly needed to strengthen health and humanitarian supply chains in low income contexts. The third point is one that's probably the dearest to my heart and the one that I think is the most misunderstood, and that is that in capacity development for human resources, we often think about training as the focus of that capacity development, and that ends the discussion. When in fact we should be thinking about a systematic approach to human resources. Within People That Deliver, we talk about 5 building blocks of human resources that really need to be explored and strengthened together to strengthen human resources. These building blocks include engaged stakeholders, policies and plans, workforce development, performance management and retention, and professionalisation. It's not only the managers of health supply chains that need to understand this, but also the program managers of multinational organisations that seek to do country-based strengthening in this particular area. So that would be the third point, and one that I think is the most important if we're really going to reach the goal of a sustainable human resources workforce in health and humanitarian supply chains. Members of the public health sector should first of all make sure they understand what a health supply chain or a humanitarian supply chain involves and what it needs. So they need to get themselves educated. They can do that by engaging in different fora, for example, the International Association of Public Health Logisticians, engaging with the People That Deliver website, or also looking at the PSM Toolbox. 3 online platforms that are free and available to help educate people around issues to do with health supply chains.